Remember, the content on our show is for information only.
It is not intended to provide medical or other professional advice.
Hello and welcome to Placebo, the podcast where each week my sister and I try and teach each other something interesting about healthcare or medicine. I'm Logan Richards, and this is my sister.
And I'm Kaylin Richards.
And today on Placebo, we're going to have a little bit of a different style than we normally do. And the reason for that is because I got very interested in a certain topic that I thought was going to be so good for the show. And it turns out there's not a lot of research involving that topic. We are still going to be looking at things that were published in peer-reviewed journal articles, but they are not going to be our regular experiments and things that we talk about.
Okay.
I have two articles that we'll be looking at on our topic. One is an opinion piece, and the other is an observation of kind of like a real world experiment. And so I'll explain those obviously as
I'm not sure how you can peer review an opinion.
Well, so the way that it works, I think, is that when they're published in these reputable medical journals, so we're going to be looking at the Annals of Internal Medicine, which is and the Journal of the American Medical Association. So those are both two huge medical journals that are well respected. I think that those types of publications are trying to branch out and add things like opinion pieces, but they're not
to make it more interesting to read, I guess.
Maybe a little bit, but also to talk about maybe future directions of research. So these articles are still written by normal scientists, and the people that in the first article that we're talking about are doctors, and they have other fancy degrees, and they probably do a bunch of other research. And this is something that they've written that has a lot of, good thinking behind it and research behind it. And it's all cited, but it is an opinion piece. It's not a study. Okay. So what I got interested in is I saw an article that I'll post on our show notes, but it was something along the line of, what can hospitals learn from Starbucks? So I got really interested in kind of the more general topic of
free Wi-Fi.
Most hospitals have free Wi-Fi.
Yeah, well, maybe they've learned from Starbucks.
Maybe they probably have learned from Starbucks. So I got really interested in the more general topic of almost kind of like customer service, like how can hospitals kind of be better for patients and health outcomes by adopting a customer service type of outlook.
Okay.
So I have two examples of this, and we'll talk about them based on both of the pieces that I've mentioned already.
Okay.
So the first one, tell me, what customer service practice do you think Starbucks might have to contribute to the healthcare model?
Well, if they make the wrong drink, they'll make you again right without charging you anything.
That's a good point, and I was thinking that would probably be the first one you bring up, because that's one of their, but that's not actually what the article was about.
Okay.
Per se.
Let me think of another one. They
more general. That practice that they do is something that they do in order to encourage a more general kind of businessy term that has to do with.
They usually encourage people to hang out and spend a lot of time there.
Okay, that's it.
That's what they want in hospitals? They want you to hang out and spend a lot of time there?
The official term, I think, is customer loyalty.
Oh, okay.
So if for some reason they make a mistake, they'll redo your drink. And I think that probably, beyond just being the right thing to do, the reason for that is to increase customer loyalty. If you make a mistake and they fix it, you won't be so upset and you'll come back next time. So what we're actually going to talk about,
they try and be everywhere so that anywhere you go, there they are. You're
That's true.
I know I get there. I'm going to go there.
That's true. And it is kind of comforting, although this is not a Starbucks ad or podcast. But
particularly if you're traveling, you're just I don't know what to eat here. Oh, there's a Starbucks. I know what that entails. I'll just go there.
We are from Seattle, though. So. So what I want to talk today about that Starbucks does, and I'm not sure they do it particularly well, but they do it a lot, is customer loyalty programs. So
they have point cards or something, I think.
So Starbucks, from what I know just off the top of my head, Starbucks has an app, and that entails that you have some type of Starbucks account. And when you buy things from Starbucks, you get points or stars or whatever. And the point of that is that at some point after you've done a certain amount of purchasing from Starbucks, they give you some type of reward. And that usually entails like a free drink on your birthday or maybe a free drink after you've spent a certain amount of money.
Sure.
So the whole point behind that is that you'll continue to come back to Starbucks because you're motivated by those rewards.
I wonder if that is a motivating factor, or if the bigger motivating factor is habit.
I don't know, but maybe it doesn't really matter. Maybe
it makes the habit, and then you're not really.
Yeah. Because it is kind of like a game, too, to do the loyalty programs. It's kind of like a game to get the points and get the rewards. So anyways, that's a lot of talk about Starbucks and no talk about healthcare yet. Another thing that I guess
I've seen Starbucks in hospitals before.
That's very true. They're in plenty of hospitals.
Yeah. Sorry. Okay.
So the other thing that I think that we'll move on to the paper now here.
Okay.
So this the first one that we're going to be talking about is the opinion piece that I mentioned. So this is published in the Journal of the American Medical Association, or JAMA as it's called. Done by 3 doctors from the University of Michigan in Ann Arbor. And it's called Health System Loyalty Programs, an Innovation in Customer Care and Service. So their main thing that they bring up is that pretty much all companies these days are doing some type of loyalty program. And it seems to be a proven fact in the business world that it's easier and less costly to maintain a customer base than to increase and grow with new customers. So
that makes sense.
The whole point of this piece for them is to say, well, why aren't we doing this in healthcare? So their evidence starts with a study of an accountable care organization. It's called Pioneer.
What is accountable care? Accountable care. It's a group of healthcare facilities and providers, I guess.
All right.
This implies that they're specifically treating Medicare patients, but I don't know if that's always the case.
What's your source over there?
The Center for Medicare Services.
Oh, okay.
They're good. Their website, their official website.
So it seems to be a group of healthcare providers, both hospitals and clinics, that have made some type of commitment to each other in order to provide the best care for their patients.
It says that they tie their payments to their quality and the cost of the care.
So we're not totally clear on accountable care organizations from what I can tell. But that's not necessarily the point. All right, so the first piece of evidence that they cite is a study that looked into the accountable care organization called Pioneer. And they had survey data that looked at over 800,000 of their customers or patients. Another word for customers, I suppose.
Yeah, I never like that. I feel like I want to treat someone as a patient, not a customer.
Yeah, they encouraged us in school to call people clients too, which I always found weird.
I find it distasteful. It feels distasteful to me to say that.
I agree, but I also feel like it seems like there's arguments the other way that calling people patients is distasteful because it puts them in a box that maybe they don't feel like they want to be in.
Yeah, I guess
so
the client.
I'm not sure.
I guess the client or consumer. What did you say? Consumer.
Yeah.
I guess that will certainly make sense focused on a customer service model, I guess. But yeah, I don't know. It just feels like it makes healthcare a business and not a calling to care for people. You know what I mean?
Yeah.
Yeah.
Another interesting point. Let us know what you think. Send us an email.
Oh, I was going to say, I was going to let you know what I think.
Oh, well, you let me know what you think then.
Oh.
I thought you just did.
Yeah, I did.
Okay. All right. So let's finally move on this one bullet point.
Sorry, you kept hanging on one bullet point that I made last week.
Okay, so over 800,000 of their patients.
Okay.
The results showed that about 500,000 of the patients remained at that same accountable care organization for a year's time, meaning that 38% of them left and went somewhere else for care. Okay, and then another example of the evidence that they cite is an older study that looked at what they call a precursor to accountable care organization, and the title of that type of group is a physician group practice demonstration. Not sure if those exist anymore. But it seems to be the same type of thing, a group of providers that have made some sort of deal to try and provide better care at lower costs. Same type of results were seen in this one, that a lot of patients around that 40% mark are moving and looking for care elsewhere. So the problem that they're bringing up
So regardless of the model, it kind of was the same rate of attrition. Right?
The problem that they're bringing up here is that these kind of care organizations are not doing a great job of maintaining customer loyalty, which of course is the whole point of the piece. Mm-hmm. And that if their goal is to be this kind of better patient outcomes, less costs, blah, 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 all those good healthcare things, then perhaps they're not doing a very good job, because all these people are leaving, seeking care elsewhere, perhaps getting too much care, paying more for care at a different place, whatever the case may be.
Does this, well, maybe it's not clear in the data. I was going to say, is this people that left the system entirely, or that just maybe had some of their care elsewhere and some of their care still in this original place?
Not clear, but the impression that I got was the latter, that because they brought this up as a point later, that they felt like, well, we're not really reducing healthcare costs if 40% of people are leaving and then getting maybe care they don't need or more expensive care elsewhere for whatever reason. They're not staying loyal to this.
But they don't know what the reason is?
Not that I know of.
Okay. What if it's people are moving, or people just didn't like that particular doctor so went somewhere else? Or
certainly possible. But again, this is an opinion piece, not a study. So these a lot of things that they're doing is using evidence that has already been gathered to speculate on what a good next step might be for both research and for healthcare system as a whole. So their point that they're bringing up is that people are leaving, regardless of the reason, and if we don't know it or not, people are leaving, and they think that it would be better for people to stay, better patient outcomes, better for costs, better for 3 reasons, which we can talk about now. So their first, I've mentioned a little bit already, is that loyalty improves patient outcomes.
That makes sense to me.
Now, they don't cite a ton of evidence on this, but I felt the same way, that if you see the same provider more often, they definitely have a better view of your story.
Right.
And are therefore maybe able to make better healthcare decisions in regards to what you need.
That's my thought, because we see a lot of patients that maybe come in repeatedly, and that, from an outpatient setting as a doctor, you probably see that even more. But maybe we see patients that come to the hospital repeatedly because they have a really complicated healthcare situation. And because they're well known to all the providers there, I think maybe it makes it easier to care for them in that setting versus if they went somewhere where they weren't known at all and their complicated history wasn't understood,
And even if they're not seeing the same provider at the hospital,
all their records are there.
Yeah, access to the complete medical record, or at least most of it. So that's
always a problem when someone is transferred, or it can be a problem if someone is transferred, because you might need to wait, or you might not have access to all of the records for whatever reason. Or,
right.
Yeah.
And therefore, patient care suffers because you don't have all the information you need.
I never get access to premise therapy notes. I never know what they were doing if they can't tell me. Yeah.
So we believe that this is a fine assumption to make, although they don't cite a lot of evidence, so it's possible that they might think it's as obvious as we do.
But just because something appears obvious to common sense doesn't mean that it's the case.
So yes, think of that with all of the points that we make here, because like I said, this is not an episode where I think we'll provide enough evidence to feel good about any of this.
We're just conversing?
Yeah, pretty much. Conversing on a topic I was interested in, and then upset there wasn't much research on.
Okay.
Because, I guess we'll just mention this now, because this is kind of more of a conversation than anything. I tried to find other articles about loyalty programs or healthcare
stamp cards
things.
for your doctor's office.
Yeah, anything.
You are 2 stamps away from a free visit.
It's pretty funny. That was the picture on the original
really?
News article.
Well, it's really
yeah. But anyways, it was hard to find. It could have been a problem of search terms, but I did all the regular searching that I usually do, and there really aren't any articles on this type of program, which is why this is an opinion piece. There's plenty of articles on customer loyalty programs for retail and
that's where it's more common, I would say.
Yeah, the evidence is there, but not not when it comes to improving health outcomes or, all these other claims that they're making in this thing. So another interesting point that they brought up was this point that patients are more likely to view the health system positively. Mm-hmm. And so this was an interesting point because it was their main opposition that they felt would be made to their opinion. It was the point that patients are often okay with waiting in line and waiting a long time for appointments and other inconveniences so long as they know that they're seeing the very best doctor or the very best healthcare provider, mm-hmm. and that all of those inconveniences on the way to seeing that very best person don't matter. Mm-hmm. So they believe that that's a myth. But there is a different school of thought that believes it's not. What their point is that they're making here is that this is not actually the case, and that patients have a harder time judging the technical skill of the healthcare provider. Mm-hmm. And what they're really judging is how they feel about the experience.
Their bedside manner.
Yeah,
that took me a long time to think of that word. Their bedside manner, but also maybe how their whole visit feels, not just the doctor's bedside manner. But
right. And so this is the point that they're making here, is that it doesn't make sense that we can assume the patients are only looking for technical skill and the very best doctors. It makes more sense that they're judging the appointment as a whole and their experience as a whole, and that's what they're telling their friends and family and other people about when they're spreading, when other people are asking them for recommendations on where to go for healthcare. So their point is that if you kind of shore up that inconsistency by making this loyalty program, which inherently makes the whole experience more positive, at least that's the goal, then you would take away some of those negatives that are pretty regular and that we hear about in the news often with the VA, people waiting so long, and the ER, people waiting so long, and all those other things. So if we were to take away all that and people were to feel better about their healthcare experience, that would be better for patient care overall, and also better for the hospital. And I guess one argument that can be made is if the hospital or the healthcare system is doing well, then theoretically patient care is going to get better or whatever because they can afford it.
If they're doing well, they can afford to do more improvements of facilities or other things, or
I'm sure
pay
that
for better staff or whatever.
All sorts of controversy when it comes to
that.
Yeah,
that's a theory. That's a theoretical point maybe that doesn't... Because maybe a company or a hospital doing very well is not as motivated to try and do better as they should be. I don't know.
Okay. Again, we will move on because the evidence in this area is lacking.
We could just ramble on and talk on this.
It's only interesting because it's interesting, and it doesn't exist at this point. The last point that they made for the reasons why they think this is a good idea for healthcare systems is that it would help them move beyond a hospital-centric model and go to a more population health type of model.
What does that mean?
Population health, well, it means basically the opposite of hospital-centric, meeting people and their healthcare needs where they are and not making them come to you, kind of, is what I take it as.
House calls?
Well, so let's move on to our next. So the next article is definitely it's not a full study, but it is published like a study. It's under the...
It's a pretend study?
It's under the title of...
It's a study in sheep's clothing? What is that?
It's under the title of observation.
Okay.
It's called On-Demand Delivery of Influenza Vaccine. Are you intrigued?
On-demand. I want the vaccine now!
Okay, so...
You know, I have an example of that, actually.
Well... Let me explain the study, and then I would like to hear your example.
Okay.
Because it'll fit better.
Okay.
So, study is mentioned what I said it was called. It's by a group of doctors and researchers in Boston, both at Harvard Medical School and Boston Children's Hospital. But their interesting affiliation is with a company called Uber.
I've heard of that company. What does that company do?
So Uber is a rideshare app which connects people who need to go somewhere with people that have cars and will take them somewhere.
Yes.
But Uber also seems to have more generalized kind of improving society goals.
It's maybe an on-demand service, like you said. Like you have the app and you say, I'm here, I need to go here, and a driver that's near where you are will come and pick you up.
So tell me about your example, and then we will move along and talk about the study.
Oh, well, the hospital where I work requires all staff to get a flu vaccine every year.
As probably does every hospital ever that ever existed.
You know, I thought that, but I was talking to another staff person who's worked at a lot of places, and he said this is the only place he's worked that did require him to get that.
Well, I have been to many hospitals as a volunteer or student, and every single one of them has required that.
I wonder, I don't know where his other workplaces were. Maybe he was in clinics or other states or something.
Countries.
Anyways, my hospital, as do many, I think, requires you to get a flu vaccine every year unless you have accommodations needed for some reason. You have to, but most people have to get a flu vaccine. And so to make it, and there's like a, deadline, you have to have your vaccine by this time. And to make it easier on staff, they will have nurses that just are regular nurses working on the floor be also flu vaccinators.
Okay.
So like one year I was just sitting on the floor writing a note at a computer, and a nurse walks
Someone just come up and stabbed you?
Yeah, well, almost. Nurse comes up to me and she says, have you had your flu vaccine yet? I said, no. And she says, do you want it right now? I said, oh, okay, I guess. And so she just gave me my flu vaccine. So I'm sitting there writing my note and then continued on.
That's pretty fun.
So it was good because I had to have it done and I didn't have to go anywhere specific for it. Just right there.
That is nice.
Yeah.
Now, you didn't demand it, but it did find you, which is
I didn't demand it. It just happened.
Okay, so let's get into this study. So the main author of this study is someone named John Brownstein, and he works at this Boston Children's and Harvard Medical School. But he's also the main health advisor person for Uber. As
They
I
have
mentioned.
A health advisor?
They do. It's this John guy.
What is he?
He advises them on health initiatives because they want to do this.
Okay. I'm still a little confused, but...
So the reason for doing this is that there is a lower number of people between the ages of 18 and 49 that receive flu shots than the healthcare system would like.
And why is that?
The reason for that is because your chances of developing the flu are significantly lower if you have the flu vaccine.
Oh, well, that's why they want you to get it for sure. That's why.
Every year, about 30% of adults end up with the flu. If you're vaccinated, your chances are significantly less of getting it.
My question is, why do not enough people get it done in?
Oh, why do not enough people get it done? Well, they don't answer that specifically. But I think the reason that this is an observation-style study and not an actual experiment is that they wanted to kind of just throw this out there as a proof of concept. In fact, that's what it's called in their words, and see if they can try and answer that question while also providing people with flu shots.
I feel like
so they don't know, but I think we'll get to some answers.
Okay, I mean,
why are you skeptical?
Oh, my feeling of why people don't want to get it. Maybe some people think that it doesn't do them any good, and maybe some people think it does harm. I think there's always ideas about vaccines. All I can say is I've had the flu a couple times, and it's rough. You don't want it.
Well, I think if we are to take the other business that Uber is known for, which is driving people around on demand,
nurses with flu vaccines.
That's what this is.
Really?
Basically, so I think if we were to take their other operation and the setup of this observational style study, then the reason that they're trying to investigate is maybe people are just lazy and would perhaps
are definitely lazy.
Get the shot if it was much easier and it just arrived where they are, like yours.
Oh, what if you were just taking a ride in the Uber anyways? And
well, that's not exactly.
Would you also like a shot? I have a supply here.
That's not exactly what they did.
Okay.
But we'll get in contact with them.
Because that would be even more. You were already there, so.
Okay. So this has happened for 2 years now. The study that they published was last year. So they published it November 2015. Presumably it happened in October last year, though it was hard to find the exact date. This year it happened just a couple days ago.
So this is something that's doing. It's not making any news.
On October 25th.
Okay.
It is making news. Perhaps it's not making your news because I read it first in the news.
Oh. All I'm seeing is political news.
Okay, so let's talk about what they did first.
Uh-huh.
So basically, they made it. They partnered with a company that already sends nurses to people's houses.
Like people that can't get out very easily.
I think that's the idea, yeah.
Okay.
And then they wrote the software, put it into their app so that when you were to, say, order a car like you normally would with Uber, there was also an option for what they called Uber Health. And you could order a flu shot. Now, the funny part that I found about both their announcement from last year and this year and the journal article piece was that they always said this thing like you could order 1 to 10 doses of the flu vaccine.
Is it like you in your office?
They never made it clear like, oh, okay, so we're giving 1 dose to you and like you can order it for like 10 people. They always said 10 doses. And
you only need 1 dose.
Nowhere did it say 10 doses for your 10 friends. It just said 10 doses.
I'm here at my house. We're having a party, and all my buddies also want a flu shot.
Right, but they never said that. So it's like you're one person and you order like 5 doses. And
I need to be very protected. Please shoot me up. I need them all.
So, although they never said it, I'm sure that that's what they meant. That if you were like at your office and there were 5 people there, you could order, up to 5 or whatever. So they partnered with a company that already had nurses in cars. So they had, legit healthcare people.
These nurses were already driving their own cars around, though.
It sounds like it, yeah. It sounds like that was their job. So they made these nurses Uber drivers for the day. Although they're not picking anyone up, all they did was go to people's places. They said you had to be in an indoor location.
Can't be just on a street corner.
So it wasn't like you jumped in their car and they gave you a shot, which, like you brought up, is not an awful idea. But maybe there's some type of insurance.
I don't feel like. Well, I don't know with the insurance.
So.
As long as you're not driving at the time that you're getting the vaccine.
So they didn't do it in our city either, by the way. Both years have not been offered in Seattle.
Where have they been done? Was it a lot of places?
Last year was Boston, New York City, Washington, D.C., and Chicago. This year I don't have up in front of me, but it seemed like it was a longer list than that.
Oh, well, it must have been successful enough if they're wanting to expand it or even continue,
right,
I guess.
I wrote that down because the study doesn't really talk about success, although you can infer a type of success because they've done it a second year now.
It must not have been a terrible failure anyway.
Yeah. The other reason that I think is interesting is that so last year, the first year they did it, it says I read several things. So it was either free, $5 or $10, and I'm very unclear on what the actual cost was. You choose? I saw some news articles reporting that it was $10. I believe that's also what it said on the Uber newsroom blog post or whatever you call it that they did.
Doesn't seem. I mean, mine is free because it's through my work, but $10 seems pretty cheap. I don't know.
Right. The study. All it talks about is a $5 cost, which it says. Well, maybe but then it has this sentence here: admission was free, and the application donated $5 to each request to the American Red Cross. Were they paying the $5 and then the admission was free of the shot? So
is Uber donating to the Red Cross as part of this?
Very confusing.
Okay.
The first year, there may have been a cost associated. This year, it seems as though it was free. I couldn't find any other options. They just came and it was free.
That seems good, at least.
Which is good because most of the time, flu shots are covered by your insurance or your workplace, and you never even see a cost for that.
I didn't pay anything.
I can't say that I've ever remembered a flu shot I've ever paid for. So, interesting because this data that we're looking at now, remember
my arm is still sore.
Is it really?
Yes. I had on Thursday.
Well, I heard that people's arms were sore. Mine was sore. I had mine a couple months ago, but it was sore.
Does it feel better now?
It feels better now.
Good.
So interesting to remember that this data that we're looking at, that it seems like there was some type of cost associated, although I can't be 100% sure on that. But they ended up vaccinating or providing a vaccine to 2,057 people.
But, well, that's a fair amount. I guess not that many if it was in a bunch of cities. Was that just the first year?
I think it's actually a good number. So that's just the first year. And the other thing that we have to keep in mind is that it was only available from 11 a.m. to 3 p.m. So only a 4-hour period of the day.
That's a very small window.
And it was only open for one day.
Yeah, that's not much time.
And they said they advertised, but like you were saying earlier, although perhaps you don't have the Uber app on your phone and maybe that's the best way to tell.
Maybe if you pulled up the Uber app.
To me, it doesn't seem like they're trying very hard to reach people. They're just kind of seeing who's going to notice and take part.
Yeah.
So not a great sample of like reaching everyone. And I don't think that that's necessarily their goal. Because again, this is just an observation. So just over 2,000 people ended up giving the shot. And what they did then was send a survey out to those people. So only 24% of people answered the survey.
That's pretty good survey odds,
So pretty good. It was so what seemed most important to me was that 78% of the respondents said that the delivery method, the way that the shot actually came to them, was their most important factor in selecting the shot
Drones.
That way. Well, no, not how it came, but that it came.
So drones.
I guess, but there was a nurse.
A drone that flies up and just goes.
Just pokes you in the arm and then leaves.
Sprays a little alcohol in there first.
Or what if it gives you the nasal one? It just sticks something up your nose and then sprays you and then leaves.
I don't think you can get the nasal one anymore. I think they said it's not working, so they stopped it. Anyways, I can just see it flying in the window.
It's just knocking on the window with a syringe in its other drone arm.
Oh, that's a little bit horrifying too.
All right. So it seems like they think this is a success, obviously, because they continue to do it another year. It seems like they've expanded the cities, although it also still seems like they're not making a huge effort to like throw this out to a bunch of people because it's not...
Well, it wasn't here, which maybe is partly why I didn't really hear about it. But
you know what? That is a very good point because advertising is very...
localized.
Geolocated these days, whatever. Yeah, that's a very good point, actually. Perhaps they did do more advertising and we just have no idea.
Yeah, because it wouldn't do much good even if they did advertise here. We'd be like, oh, great.
Right. So I first heard about this on a website called Stat Health News, which is... just like journalists writing about health, basically. What was mentioned that was interesting about this that they brought up was that what if this type of thing were made available to hospitals and it could help them reduce the amount of missed patient visits?
In what way?
Well, the example was given that someone needed a shingles vaccine, but for whatever reason wasn't able to make it in. They couldn't remember, or maybe they were in so much pain that they couldn't get there. Whatever reason.
Well, and that's typically aimed at an older population, so maybe they don't drive and they can't get there very easily. Or
so I think what ended up happening, it sounded like this person ended up getting shingles, and then they were in a ton of pain, and they needed this medication, weren't able to get it. And the doctor who wrote this piece said, well, wouldn't it have been fantastic if I could have given an Uber-like service and just sent it to them wherever they were? And so this, again, comes right back to the moving away from a hospital-centric model to a more population health kind of thing.
I think one thing that pops into my head that would be a problem is that for the population, the more elderly population, I don't think that like smartphone use is super high. I don't know. I mean, certainly some people do, but I don't think that the majority of people do.
Well, you bring up a good point. So when I read these two and was kind of getting interested in this topic, it seems to me that healthcare in general just has a really bad software problem. Like all the software they use is so bad. And if they just use good software, like I'm not a computer scientist or an engineer or whatever, but when you look and use Uber, that is infinitely better than when you look and use the old clunky EMR that hospitals have, or
I definitely do have, or I have met
awful, check-in software that your primary care doctor has, or whatever.
Yeah. I mean, I definitely do know of older patients that don't drive and that use Uber to get around.
Yeah.
Because
it seems like a good option, right?
Because they have a smartphone, and it is a pretty simple app to use, I think. It's not a good complicated or bulky app. Yeah.
So when I was thinking of all this, it just seems like healthcare in general has a software problem. Like a lot of these challenges, like this, like a loyalty system or like an Uber-like delivery of healthcare, whatever that may be, would be, I'm not going to say it would be easy, because it wouldn't be. It would be a huge thing. But
our healthcare system needs to change.
Could be solved with an easy-to-use app that's, developed by smart people and would take a lot of work. But, Uber is able to come out and basically without even trying, at least not making it seem like they're trying, is able to give, 2,000 people flu shots just because they wanted to see if it would work or not. Other places, like healthcare places, blast you with ads, and they're trying to get you to come in and take the flu shot, and a huge amount of people still don't. And now, for whatever reason, maybe those people are never going to get the shot anyways. But a lot
of people, it'll say something like lost to follow-up in their chart, meaning like they had something that they should have had looked up on or followed up on, but they just didn't for whatever reason.
Well, this was another point brought up in this article by the doctor that I mentioned earlier, the Stat News Health one, was that, we kind of, healthcare places, when you miss an appointment, they kind of they give you an email or a phone call, and they say, you missed an appointment, that's no good. If you miss another one, we might let you come back, and that's kind of how it works. But they're saying like, well, if we just had the right, if we just had the right way of reaching these people, and maybe them coming in is not the right way, but if healthcare providers had the right software that would, communicate with them appropriately and then give them access to care in a way that worked for them, we wouldn't have any of these problems.
Well, a lot of the more older population, which is the highest user of healthcare services, a lot of them maybe don't use smartphones now, but look in 25 years.
Yeah.
I bet that's going to be very different.
It would seem that way. And you're right, because I would imagine, at the speed that technology moves, like someone has had this idea. Someone knows that, smart people who know how to make this type of software know that this is a problem. The problem is that the major user of healthcare doesn't want to use the thing that will allow them to get better healthcare.
Maybe they don't. Yeah, maybe they just don't have interest. Maybe it's too expensive to afford. Maybe they're like, well, I've gone this far in my life. I don't really need to learn a new thing like that now. I don't know.
There are obvious barriers, but you do wonder what would happen if for just a second you could take all these apps that have already been made, already could address a bunch of healthcare problems, and just use them for a while and see if they improve patient outcomes. But we can't because of all these barriers that are, some obvious and some probably that we haven't thought of. Okay, if you enjoyed this episode that ended without any real points and didn't even have any real research,
there were points.
Please share us with a friend or give us a rating on iTunes.
Yeah, you can visit our website, placebopodcast.com, for show notes or to send us any suggestions or feedback. We love that.
You can also find us on Facebook.
Thank you to James Aiken for our music.
And thank you to all of you for listening. We'll be back next week with a new episode.
And a cliffhanger ending. Goodbye.
Bye.